There's been a lot in the news lately about United Healthcare and the death of their CEO recently. A number of people have suggested that this is all the result of frustration with the healthcare system in general and with insurance companies in particular. Many people have asked me over these last few weeks about how all of this stuff that happened relates to our practice and how it impacts our practice. These questions about patient frustration are one of the main drivers for why our practice is a direct care practice. The patient has the relationship with me. You, the patient, have your relationship with the doctor, and there's nobody that interferes with that relationship. There isn't, an insurance company or anybody else trying to decide what you can or cannot do, what you can or cannot get. You decide what your problem is worth. Not some third party, not some person 1,000 miles away in an ivory tower who's never met you, never examined you, doesn't know anything about you. Not some artificial intelligence algorithm. We got out of the insurance game because I was tired of patients coming and yelling at me over the bill, because if they had known beforehand what it was going to cost, they might have done something differently. I didn't have any control over that bill when I was working for the hospital. I didn't have any control over that bill when I was working with insurance companies. I didn't have any control over what the patient was going to pay, or even what the patient might find out about what they're going to pay until after the fact. And at the end of your pay period, when payday comes, you expect to get paid. But in an insurance-based model, we wonder when we're going to get paid and if we're going to get paid. And in fairness to my patients, we wanted to offer them transparency. We wanted to offer you the opportunity to know what you're getting yourself into, and then to be able to make the decision yourself. This is what we call free market medicine. And I'm excited to announce that at this year's Free Market Medical Association conference in Oklahoma City, I'll be featured again as a speaker talking about these very questions and these very topics. It's for anybody who is interested in fixing the problems that we face today in our healthcare system. I would also invite you to check out our podcast on free market medicine. It's called The Direct Care Movement. You can find it on a bunch of different platforms. You can find it on Apple, on Google. You can find it on YouTube, and then of course on the Hey Influent website. What happened to Brian Thompson is a tragedy. And I am not going to say that whoever it is that shot him is some kind of hero. I'm a fan of Batman as much as the next person, but that's not how the real world works. In the real world, when we have a problem, we find a solution. And that's what we're offering here in our practice. That's what the Free Market Medical Association is offering. And that's what many other doctors around the country are offering. Help us to raise awareness of these alternative models, of the parallel ecosystem that we're building to restore fairness, to restore the doctor-patient relationship, to restore affordability and transparency to healthcare, so that the tragedy that befell Brian Thompson ends up being an isolated event in our rearview mirror rather than the beginning of a trend.